Hi guys, let's talk about low energy, fatigue, being stressed, and low libido. This affects all guys in their late 30s, 40s, 50s, 60s, and on up. There is a solution. There's a natural solution, and we just need to identify where the problem is occurring. I'm Dr. James Leonetti. I am the director at the Functional Medicine Clinic at a lot of people come in here and they're going to tell me, hey, I've been to my medical doctor and they just don't understand. They say I'm going out of energy or my libido's down or I'm not sleeping well, and they just attribute it to getting older, older age. But that's not necessarily the case. What we need to do is to sit down and have a discussion with the case history and get an idea of you. We need to do an assessment. We need to look at heavy metal toxicity. We need to look at the way the neurotransmitters in your brain is working. We need to look at basically your overall energy level. We need to do some tests to see how your immune system is working. And pretty importantly, we also need to see what the blood work looks like. And it's not just like one thing here or there or just the typical blood work. A full panel is usually needed so that we can assess where everything is, where the organs are, where the energetic states are. On top of that, we'll probably need to look at some neuro testing, some functional neurology testing to see where your system is. We put all this stuff together. It's a comprehensive exam. We put all this stuff together to understand where your current state is. So if this is starting to sound complicated, that's because it is. We are not straightforward. We have a lot of things at play. Everything from neurotransmitters to hormone imbalance. So what we need to do is to get to understand you. We need a good comprehensive exam. We need a discussion to understand where you've been, where you want to go, and how what you're willing to do to get there. We need to understand what your internal chemistry is doing. We need to understand what your kidneys, your pancreas, your thyroid, if you have autoimmune disorders, and yes, they are common in guys, probably just as much so as they are in females. Let's talk about treatment. Is this something where you can just run to GNC, grab an oil or a protein or something and just pop it in and take it every day to make you feel better? And the simple answer is no. There's a lot of complex things that are going on in most of these cases, and you can't replace it with one thing. That would lead to a significant imbalance in your system, and your body needs to be balanced. Treatment-wise, at our clinic, it ranges. It's very customized per person. We have everything from herbal remedies, we have high quality dietary supplements, we have exercise therapy that's with oxygen. We have some of the most high-tech systems and equipment to help put energy back in your system so that your body can naturally heal. We have everything from acupuncture. You may need a chiropractic adjustment. You may need brain exercises. It's a full systematic approach to getting you back to being balanced and so that you can be healthy. How long does it take? That's another big question. Each person is going to be different. I've had short-term treatment plans that run from a month or two to some of the more extensive things where people have a lot of significant issues that run about 6 months. But at that point, we fully expect that your system, your body will be back into normal state and be able to handle all the stressors that go with it. And so we'll verify that. Along the way, we do some testing. We follow up with a lot of the autonomic nervous system tests. We follow up with the toxicity tests. We follow up with the blood work, because I want you to see that you're getting better. You want to know that you're getting better, and it goes beyond just feeling vibrant and being able to get back to the gym and having a good sex life again. And so we want to make sure that not only do you feel better, but that the internal chemistry inside of you is working better, and it will be for a long time. Now, I'm a guy. I understand that you may not want to go to the doctor. You may be a little bit embarrassed, and it kind of is a big ding to manlyhood when you have some low energy and low fatigue, and especially low libido. But there's a solution. There's a lot of guys there. There's a lot of guys that need help, and I want you to understand that this is a safe place, and we can sit down, we can talk about that. We can come up with a roadmap for the testing process and a roadmap for what the treatment plan would be, so that you can fully understand what we need to do to get you better. So give me a call at 304-933-9355. Set up an appointment. If you want to speak with me directly, I will be happy to do that. And let's get you back to being vibrant, youthful, and energetic again.